Hello, my name is Gail Chapman. Today we're going to be talking about abuse and neglect, the reporting requirements in the state of Michigan. Child Protective Services was established by Public Act number 238 in the year 1975. This Public Act defines child abuse and neglect as harm or threatened harm to a child's health or welfare by a parent, legal guardian, or any other person responsible for that child's health or welfare. So what must be reported? There are 4 distinct criteria for reporting child abuse or neglect. Of course, there's physical abuse, neglect, sexual abuse and sexual exploitation, and maltreatment. Physical abuse is defined as the infliction of any non-accidental physical injury to a child. Examples include hitting, biting, kicking, slapping, shoving, burning, etc. Injuries may also be the result of over-discipline or physical punishment. The intent of the perpetrator of physical abuse may in fact not be to harm the child physically. Things that you may want to look for if you're seeing children: to identify physical abuse, multiple injuries that are in different stages of healing, pattern bruises or scars, bruises or burns on a non-ambulating infant. That's an infant who doesn't walk, an infant who can barely crawl but yet has managed to fall down the stairs. Very suspicious. Bruises on earlobes. Children that flinch when they're touched or when you approach them, even if not to touch them. Bite marks, rib fractures, liver, kidney lacerations, pattern contact burns. That's like a cigarette burn or a lighter mark burn. And injuries that aren't consistent with any history that's provided by the adult or the child. Child neglect is defined as failure to provide for the child's basic needs. This includes the lack of adequate nourishment, shelter, clothing, education, medical care, proper supervision, or a safe living environment. Indicators of child neglect include a child who's persistently hungry, and who may steal or hoard food. If you notice dramatic weight changes in a child client, you may want to be concerned. A child who has excessive school absences, reoccurring untreated medical issues, ongoing lack of supervision, consistently inappropriate dress, and persistent poor hygiene. It's important to note here that just because you see one, maybe a couple of indicators in this area doesn't necessarily mean that it's neglect, but you also cannot rule it out. You want to find more information and find out what's going on with your child. Child sexual abuse is defined as any sexual contact or penetration with a child. Almost always this involves some sort of tricking, forcing or bribing, threatening or pressuring the child into the act or into the sexual awareness. Examples of this include rape, fondling, incest, sodomy, exhibitionism. Child exploitation is slightly different, but still along the same lines. This is allowing or permitting or encouraging a child to be depicted in a sex act. It's basically the use of a child for the sexual pleasure and gratification of someone else. Examples of this include child prostitution and the use of children in the production of pornographic materials. Indicators of child sexual abuse and sexual exploitation include age-inappropriate knowledge or sexual behavior, sexually explicit drawings, sexually explicit behavior, unexplained fear of a person or a place, pregnancy, venereal disease, frequent urinary tract and or yeast infections in female clients, unexplained itching, burning, pain, or bleeding in the genital area. Child maltreatment is defined as treatment of a child that involves cruelty or suffering that a reasonable person would regard as excessive. In our definition so far, this one is probably the broadest. But examples of child maltreatment would include things such as locking a child in a closet as punishment, forcing a child to eat non-human foods such as dog food, cat food, grass, teaching a child to assist in criminal activities, such as running drugs, stealing.